Today I'm going to be going over basic ultrasound IV insertion technique. The first thing I like to do is just prep in a large portion of the patient's arm. So by cleaning off the arm ahead of time and just covering a large portion, I know that I'll have a bunch of potential targets and I won't have to wipe off my ultrasound gel to clean the arm after I found where I want to go. Next thing I'm going to do is I actually put the tourniquet on pretty early, sometimes before I even prep the ultrasound machine or anything. And this way the veins of the patient will be very well engorged by the time that I get back to the patient's arm with the probe, and I won't have any trouble finding good potential targets. Now I'm going to put a little bit of gel on the probe before I put the probe cover on, and that just helps with image quality by getting rid of any potential pockets of air that could be between the probe cover and the probe itself. Another good way to minimize the amount of interference you have from any trapped air is to wipe it off like I just did, and then use a rubber band to keep the plastic nice and tight to where you've secured it. Now I'm going to show you guys what the image on the ultrasound looks like. I'm going to go ahead and put the transducer down and start looking for some potential targets. So what you see here is there's a couple circles down there representing possible arteries or veins. I'm going to compress, and you should notice that the veins are very collapsible, but arteries are not. Coming up here in the second on the right side of the screen, you're going to see a pulsatile artery, so that's not a good target. Here, now this looks like a potential vein. You see me compress, and it collapses very easily, so that's the target I'm going to be going for. Now I'm just going to put a little more gel on because, as you'll see in a second, gel is key to being able to visualize the needle well. So this is actually going to bring us to our first key step. Now I like to call this lining up your shot. So what you're going to see me do here in a minute is I'm going to take the blunt end, that's the opposite end of the sharp tip, and I'm going to press into the patient's skin. I'm going to be pressing right at the foot of the ultrasound probe, and I'm going to be watching where I'm depressing that tissue on the ultrasound image. So this is going to help me decide exactly where my needle needs to be put so that I line up with that vein. So I'm going to poke around a little bit. You're going to see the tissue get depressed, and then I'm going to take that blunt end and I'm going to draw a line in the ultrasound gel. So the point of drawing the line is I see a lot of people try to line the vessel up with the center of that ultrasound probe, and if you move the probe at all, you're going to be off center from where you thought you were. So drawing that line actually gives you a physical representation on the patient's skin that even if you move the probe, you still have an exact target of right above that vessel. So the second key step is hitting your target. So we can accomplish this by using the idea of an isosceles right triangle. So if we look at this image, we see that if we have the probe perpendicular to the patient's skin, the distance down to the vessel is going to be the same as the distance that the needle needs to be from the probe if it's inserted at a 45-degree angle to hit the vessel exactly where we're looking at. So here on the side of the ultrasound image, we can see that the depth of this vessel is a little less than 1 centimeter. So here what I'm going to be doing is looking back about a centimeter from the face of the probe, inserting my needle at a 45-degree angle, and then I know once I get down to my vessel, I'll be hitting it exactly at that spot where I was looking. So right after I poke the skin, the next step I'm going to take is optimizing the view of my needle. So what I see a lot of novice learners doing is they attempt to keep track of their needle by bouncing around the soft tissue. Now this is obviously not optimal because you don't know where your needle tip is, and especially if you're going for a small target, you could easily be in front or behind that and the tissue would still be moving around and you wouldn't actually be in the vessel. So the key to understanding how to optimize the view of your needle is knowing how ultrasound works. So on the left of this image here, we see that the probe is sending out a beam, it's hitting the needle, and a lot of that sound is getting reflected away. So the way that the ultrasound actually decides how far away an object is by time of flight. And the way that it decides how dense an object is by how much of the sound is reflected back to the probe. So when it comes to inserting an IV, we really want to see the needle as bright as possible. So our goal is to get as much of that ultrasound reflected back to the transducer as possible. You can see on the left that since a lot of that is getting scattered away, the way we would improve that is by getting a perpendicular angle between the probe and the needle so that all the sound that's sent out is actually coming back to the probe, and the needle will be at maximum brightness at that point. The way that you're actually going to accomplish that is by using a good amount of gel so that you can increase the angle of the probe against the skin so that you are at a perpendicular angle with the needle insertion, and that's going to give you maximum needle brightness. So I'm going to slow this video down here, and what you can see me doing is I'm actually leaning the probe back so that the beam is perpendicular to the needle, and then I'm going to slide up the arm until I see a nice bright white needle at the top of the skin. And now I'm going to adjust my angle a little bit forward and backwards to get the needle as bright as possible, and then I'm basically going to lock in that hand that's holding the probe. I'm not going to change this angle for the rest of the IV insertion so that I know I'm optimizing the brightness of my needle along its entire path. So this is a graphic that's representing exactly what we just described. So here in transducer position A, you see that there's a good perpendicular angle between the transducer beam and the needle itself, giving you maximum brightness. So that's basically what I'm seeing there at the skin. Now what I'm going to do is I'm going to lock in that angle like we described, and I'm just going to slide the probe up the arm until I see an image that looks like B and then C. So what that's going to represent, as you can see, the beam just slides right off the tip of the needle, so I know exactly where the tip of my needle is in the soft tissue. Probably the biggest key once you're at this point is to never advance either the needle or the probe at the same time. So what you want to be doing is going between images B and C on both the ultrasound and your probe positioning. You want to see image C, advance your needle until you see image B, and then pause with your needle, and then advance your probe up the patient's arm until you see image C again, and then advance the needle until you see image B again. So basically what this is, it's going to be showing you your tip all the way down until you get to your target vessel. So I'm just going to play the rest of my needle insertion and mention a couple comments as we're going through, but you guys will basically be able to see what I'm doing. Just keep an eye on my hands and the ultrasound image. So every time you see the bright needle come into the ultrasound image, you should see that I'm moving the probe up the arm, and then after I don't see the needle anymore, I'm going to be advancing the needle once again. So what you see here is the nice bright needle up at the top, and then you see I advance the probe until I don't see the needle, then advance the needle, then advance the probe till I don't see the needle, and I continue this process all the way down to the vessel. So now you can see right here, I clearly have the needle inside the vessel, and this is going to be the last key portion of the insertion process, and that's going to be walking the needle down the vein. So what you're going to be doing here is you're going to flatten out your angle, and you're going to keep that bright white dot right in the center, and you're going to continue to advance so that you don't see your tip, and then you see your tip again. This is going to be called the disappearing target sign, and you want to try to keep that needle right in the middle of the vessel the entire time you're doing this. So I'm just going to play the rest of the clip, and you're going to see me walk the needle as far as I can down the vessel before I thread the catheter. So after you've advanced your needle all the way down the vessel, you're just going to thread the rest of the catheter that remains, and you're going to hook it up to your IV extension tubing. This should already be pre-flushed. And then the key portion here is to really wipe off all that gel. So you have a lot of runway of the catheter inside the vessel, so I would kind of just hold it vertically and make sure I get all the gel, even the gel that's underneath the hub. So once the patient's completely wiped off and you're sure that all of your gel's been removed, you can go ahead and secure the IV down. Now here I'm just using a small tegaderm. We have other better securement methods, some larger tegaderms and things that will hold ultrasound IVs on better, but this is the most basic securement method that we really have. So just to make sure that this is a little more secure, what you'll see me do after I do this is to add some tape right at the base of the insertion, just to make sure that we don't lose that catheter. Now I'm going to flush to make sure it's still flushing easily, and I'm going to actually aspirate as well right here and make sure it's still withdrawing blood pretty well. Go ahead and flush. And then the last part, I'm just going to secure the top of that IV up so that it's not hanging loose and having the potential of getting dislodged by the patient moving around.